Hello, everybody. I think the voice is going well in the direct. I hope the voice is going well. Hello, everybody. In our channel, there is direct today, direct about clinical cases. Welcome to our channel. Welcome, everybody. And let me see if all is working well in the other socials. I think it's good, and I hope you enjoy the today lecture. It is a lecture about the patients, clinical cases discussion. This is the topic of today. The topic of today is clinical cases study. And every month we will do something like this in direct in our school with me. Study different patients in the way we work in our school. That is the main thing. This is to see how we make the diagnosis in our school. I hope you enjoy it. This recorder will be in YouTube later and you will see anytime you want. Okay. All right. We will start the today lecture. Today lecture is important to see. Welcome, everybody. I am here. I am Professor Di Rocca and I am the director of the NPR International School, and I decided to do this live in YouTube. Why? Because it's the way we have to communicate with our audience in all our social through the YouTube channel. If you enjoy it, if you subscribe in our channel, you will help a lot to grow the channel, and you will receive, if you click the bell, you will receive the announcement of our webinars we will do in our channel. This is a special way to study. This is clinical cases live talks. In our virtual room, if you in the future will be in our virtual room, you can do it. You can stay in our virtual room also, and you can see how we communicate together. In the virtual room, you can talk with me, you can talk with everybody discussing with me, all right? Okay, clinical cases. I will start the today talk. That is the clinical cases. This we will see two different patients in this webinar. One of the patients will be with diagnosis, all of them, but you will see one of them diagnosis and the other why. If you leave some bad rehabilitation, you can create chronic pain in our patients, and that is the meaning why I am trying to do these webinars to show the way to see the patients, and another way, who is the NPR methods way. Okay, we go now through the direct to the webinar. All right, clinical cases is the topic of today. Clinical cases, the way, why, how we do our diagnosis. Our diagnosis, the way to do the NPR diagnosis. As you know, our protocol is, and if you know, I will try to explain to you that is the way we can roughly communicate with all medical sciences. There is a protocol for communication in our channel and in our school to how we see the patient, and this is how I will show you now. We do that. Okay, we're starting now the presentation. We go into our first patient in the day of today. We will see two patients today. We'll see two different patients, and I will try to show you how is our point of view in the diagnosis, NPR diagnosis. First one, we will show you a way for holistic diagnosis. This particular patient, it is a patient with neuromuscular pathology, and it's very important in that type of pathology to do an holistic diagnosis. That is an integral diagnosis. What they mean, integral diagnosis? Integral diagnosis. What mean the integral diagnosis? The integral diagnosis is a diagnosis in the whole vision. Interdisciplinary is a diagnosis in an holistic vision. Holistic means the way to see the patients, in integration. Medicines normally are doing the in my opinion, they are seeing the patient more locally than general, and that is no good in my opinion, because we are talking about one part of the body. Holistic is the way to do the best diagnosis in the body. Study the craniofacial system. Normally we are confusing. We are confusing craniofacial system with TMJs. TMJs is part of the craniofacial system. It is not the real way we have to see the TMJs. TMJs is the let me go a little bit back. The PowerPoint goes ahead. Going here, okay, the craniofacial system with the rest of the body. TMJs is part of the craniofacial system, and when craniofacial system is dysfunctional, when the craniofacial system is dysfunctional, we have a compensated postural disease. That's why we said in our school we will observe the patient with the dysfunction of the stomatognatic system and the posture. This is the goal in diagnosis. Okay, we go through the clinical history of this patient. We see the face of this patient is hyperactivity in the neck and in the whole muscles of the face. That means something. That means something that is not working very well. And clinical history. Look at the muscle here. Hyperactivity in the neck. And look at the jaw. Lateral deviation. The head is deviated. And this particular patient had a diffuse neuromusculoskeletal system. Had a lot of pain for many years. Treating with different techniques, but in my opinion, only locally. we see here the cervical and lumbar area with pain for a long, long time. Dizziness. All these symptoms are connected with the craniofacial system dysfunction. And that's very important. We understand the situation to understand the disease. Diffuse general fatigue that is aggravated when waking up. When you have a craniofacial dysfunction, the patient do bruxisms during the night. They don't sleep well. They are not going in a deep sleep. Stays always in alert. The central nervous system. That's why this patient have fatigue when they wake up. Difficulty in sleeping. All patients with temporomandibular disorders have a lot of problem to go to sleep. And it's very important to understand that craniofacial system, it is not just TMJs. And now we go into study the posture. If you see the posture on the back, we observe something here who is we call that the thoracobrachial triangle, who is wider in one side than the other. That is suspecting a short leg that can be real or false, but it's a short leg. Rotation of the pelvis, and sometimes that is connected also with the craniofacial system dysfunction and the biochemistry, alimentation, intoxication of the body. Imagine, we are talking here about the people who want to do rehabilitation of the body, but we don't take care of all this thing of diagnosis. We go in here, profiles. If you see the profiles, both profiles, the angle of the profiles are different. One bigger than the other, different profile angles. We suspect when we see that pictures, imagine that's simple diagnosis. When we suspect, when we do that particular sign, we suspect 3 inches blocked. Cervical, lumbar, and podalic. That is the diagnosis, integrated diagnosis for everybody. And then we go to the eyes, the oculomotor system, that is a system, one of the main receivers of the body. Remember, one of the main receivers of the posture, of the tonic postural system, one of the main receivers. And if you listen to my talk, you see that it is impossible to treat this kind of patient only in one way, with only one discipline, with only one protocol. This is why we said we have a real protocol, interdisciplinary protocol, with all medical sciences are looking the patient in the same way. Look at here, oculomotor system, no convergences. there is bilateral hypoconversion, also related with the jaw posture, the jaw position. I will do some video regarding that, just to understand this. We have a lot of video on our channel. If you subscribe in the channel, you will see that. A lot of videos that show how is the connection about of the motor system and the rest of the body and the occlusion. Look at here the teeth position. We call that in dentistry retroposition. This retroposition is making the position of the jaw back. We call that in dentistry retromandibular position. And that is connected with bilateral hypoconversions. Imagine jaw position altering one of the most important receptors in the tonic postural system. And with the posturometer is an objective instrument. We can do an excellent diagnosis with the posturometry and follow our patients. And I will show you now the measures of this particular patient. Look at here, posturometry. Posturometry and posturometer is based in the Capanghi distribution of the wave on the floor. And look at here. On the right, we see the patient with the mouth open. That means it's not interferences with the jaw position. And if you see that, the other one is the mouth closed. Now look at here. Zero unbalance when the mouth is open, but if you see the patient close the mouth and increase the overload in 3.8 kilos, that means the jaw position is affecting the body balance, the muscle chain. How is going the body center also to the left, back and left. That show with an instrument, this is science, that the occlusion change the jaw position and the jaw position affect the whole muscle change. That's important to understand, and it's important to see, to see that, all right, to observe that in diagnosis. And then we go into chronic pain, another patient. Patient with the chronic pain, the chronic pain patient, imagine. A patient with the chronic pain. You know, we said that chronic pain patient, a chronic pain patient. Second patient. Dysfunctional oral rehabilitation that is creating a postural dysfunction during the life of this patient. Another thing we have to pay attention, dentists, when we do rehabilitation, do not affect the whole body, please. And look at here. The prosthetic reconstruction with very poor dental anatomy and without any guide, without any functionalities during a long time, who is keeping the jaw in a bad position with a dysfunctional occlusion that severely affect the posture over more chronically during the long time. Therefore, it is important not only to rehabilitate the patient well, but also to find a central relationship of the jaw and a good vertical dimension in balance with the body, and obviously a good occlusion. That's the patient, and if you see the neck of the patient and the hyperactivity and craniomandibular disorder affecting immediately the neck. Look at here, muscle hyperactivity here, a lot of muscle hyperactivity. Look at the head, the vertical dimension loose, and the whole system under dysfunction. Hyperactivity chronically is creating problem in the whole body and a lateral deviation. The jaw is lateral deviated to the right. And look at here also, the triangle. We saw the triangle last time in the other patient. Postural alteration. Also here, the triangle, one different than the other. And the hypoconvergence. One of the main receptors affected by the jaw position, bilateral hypoconvergence. And look at that, the situation of the teeth. And this is a very bad ceramic rehabilitation, very bad. Very bad position, very bad prosthetic rehabilitation. That is chronically creating a lot of chronic pain, Jaw lateral deviation. We saw that before in the picture. Look at here, no occlusion, no guides, nothing, no occlusive plane. That is creating a lot of problem. This dysfunctional occlusion is creating a lot of problem in the posture. It's creating bruxisms. Imagine bruxisms over the ceramic. That is creating a lot of hyperactivity in the muscles, cranial muscles, and then in the posture, in the muscle change of the body. Look at here, the abrasion, how the patient has tried to eliminate the situation with bruxisms. That is a patient who suffered with pain for more than 10 years. Carry on a lot of specialists, and they say, everything is okay. I don't know why you suffer. Defensive bruxisms ruin the anterior guard. And the joint, and look at here, chronically, is destroying the disc. Here is, the disc is broken and deformation of the condyle. Why? Because it is overload into the joint. Intradisc alteration. Condyle deformation. And with the posturometer also, the posturometer shows us we can measure the postural alteration. And you will see now what happened with a situation like this, not only locally, just to the posture, Look at here. This patient, postural alteration, mouth open, 3 kilos. Mouth closed, 8 kilos. 3 to 8. Look at how it's increasing the overload through the time to the body and to the muscle chain. That's important to understand that. That is very, very important to understand. Very important. Very big overload. 3 kilos and 8. Look at the varicenter. It's here and here. Look at here. How it's changing here to here. Not only to the left, but also is going to the back. That's very bad for posture. Very, very bad for posture. Look at here. Mouth open, close. Open and close. Look at here. Open and close. How it's changing. Okay, I hope this little presentation was very good for all of you. Enjoy that, and if you like the video, click and subscribe to the channel, do a like, and you will help the channel to grow. And every month I will try to do some discussion cases, different patients, different situations. We do also treatment, how we treat in our school. If you are interested, just in the YouTube you can write in the community what is the best topics you want we treat. Okay, I saw that was a very, very important topic, that is the relationship between the craniofacial system and the rest of the body. That's very important. I hope you enjoy it. You have the video in the YouTube channel. If you subscribe, you will see all the news in our channel, and you see a lot of video we have in the channel. Okay, see you, all of you, in the next presentation live. If you like it, I will see you in the next month with a live presentation, and we will put every week a lot of videos in our channel, different topics, different languages. Bye bye everybody, see you in the next presentation. Bye bye.